Joining us now, Dr. Suresh Ramalingam. He is Associate Professor, Chief of Thoracic Oncology, and Director of Medical Oncology at Emory University School of Medicine in Atlanta, Georgia. Thanks for stopping by.
Thank you for having me.
All right, so you've got news on the clinical potential of Ganetespib, a second-generation HSP90 inhibitor. What can you tell us about this HSP90 class?
Sure. So heat shock protein 90s are important cellular proteins. What they do is when a new protein is formed, it has to go through some conformational changes before it can actually be active. And for that change to occur, you need what we call as client proteins, of which heat shock protein 90 is one. So if you think of cancer cells, they're all dependent on some specific dominant oncogenic pathways. And all these dominant oncogenic, either mutated or overexpressed proteins, require the client protein function for them to go and do what drives the cancer cell. So we have strategies that block directly the receptor or the way these proteins act. Or another smart way to do it is to attack the client protein and thereby inactivate the oncoprotein to work. So that's what heat shock protein 90 does. It is a chaperone protein. The oncoproteins need them, and Ganetespib is a drug that inhibits these client proteins, thereby inactivates the oncoprotein. So essentially, taking off the food supply that the cancer cells need by inhibiting the channels that give them the food supply.
We talked with your colleague, Dr. Shapiro, here last year about this very compound. What kind of an update can you give us about it?
So last year, Dr. Shapiro presented a large phase 2 study in non-small cell lung cancer where patients were given Ganetespib as a single agent, and he showed that there was very promising activity, and in particular patients who had the ALK translocation, which is seen in about 5% of lung cancers, non-small cell lung cancers, there was a very dramatic responses seen. So that has now been substantiated in more larger patient cohorts. More preclinical work has been done that clearly shows that HSP90 is very important for ALK function, and Ganetespib is very active. And in fact, in preclinical studies, it stacks up very well against crizotinib. So now there is a large ongoing phase 2 trial that will evaluate Ganetespib in patients with ALK-positive disease. So that's one strategy that's being moved forward. The other area where we have some encouraging news is combination strategies. So we know that in preclinical setting, combining taxanes with HSP90 inhibitors is very active and synergistic in preclinical models. So what we've done is now initiated a large randomized trial with Ganetespib in combination with docetaxel for patients with advanced stage non-small cell lung cancer. So this is an international phase 2 trial with an estimated sample size of 240 patients. And in this trial, patients are randomized to either docetaxel alone or docetaxel in combination with Ganetespib. And we've already enrolled almost 2/3 of the patients for this larger trial. And we have been monitoring the safety very carefully, and we have also been looking at what kind of clinical leads are available. So what we can say is the safety profile is very good. We did not see any evidence of synergistic toxicity. What one would have predicted with Ganetespib, such as diarrhea, are seen, but they are easily controlled with appropriate prophylactic medications. And the combination didn't seem to have any excessive myelosuppression or other toxicities. So we're very encouraged by the toxicity profile. The study is still ongoing. We're collecting tumor tissues from these patients to look for mutations in major pathways such as KRAS and so forth, to see how that specific event would link with outcome. So we are presenting a poster at this meeting about this clinical trial, showing us the design of the trial, sharing information about the eligibility criteria and the statistical strength of this trial. We hope to have the results very soon.
What would you like to add about the Galaxy trial?
So the Galaxy trial addresses an important area of need in lung cancer, which is in patients who have progressed after first-line therapy. We have 3 approved single agents in lung cancer: docetaxel, pemetrexed, and erlotinib. But so far, we have not had a successful strategy to move beyond single agent into the combination setting. The Galaxy trial intends to accomplish just that: develop a novel combination for second-line therapy to go beyond what we see with single agent treatment. We have very sound preclinical data. We have good phase 1 data that combines Ganetespib with docetaxel, and now we have substantiation of the safety data in our ongoing phase 2 trial. And we are encouraged by what we are seeing so far in the trial.
When would you expect to complete that?
So accrual to this trial will be completed, we hope, within the next 4 to 6 months, and we will have the results hopefully for the next year's ASCO meeting in full strength.
Very good. Okay, the pressure's on, the clock's starting.
We look forward to it.
Doctor, thanks for joining us and best of success in your work.
Thank you very much. I appreciate the opportunity to share this with your audience.